Video, we'll be talking about the post-vaccination protocols. Many people think that if you are on medications, you can't get the COVID-19 vaccine, but this is not true. Taking one of the following medications is not a reason to avoid getting your vaccine, and this includes statins, blood pressure medications, diuretics, thyroid medications, diabetic medications, and insulin. If you have recently undergone surgery or are on a combination of medications, you should talk to your doctor regarding the vaccination and any other questions that you may have. Some of the most important ways you can protect yourself from COVID-19, apart from taking the vaccine, is to stay at least 6 feet apart from one another, wear a mask, and practice proper hand hygiene. This is important as COVID can spread when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are spread. These droplets land in the mouths or noses of people as well as nearby surfaces. The spreaders of COVID are usually asymptomatic, and that's what makes this disease dangerous to us all, because we don't know who has it and who doesn't unless we present symptoms. Currently, the distribution of vaccines given to Malaysian adults is shown in the pie chart below. All of these vaccines have been proved to be effective and are on the WHO's emergency use list. All these vaccines are administered intramuscularly. CanSino, Johnson & Johnson, and CanSino Bio are single-dose vaccines, while AstraZeneca, Pfizer, and Sinovac are all double-dose vaccines. The following table shows the number of doses required and the recommended time to wait in between double-dose vaccines. You are considered fully vaccinated after 21 days from a single-dose vaccine and 14 days after a double-dose vaccine. Common contraindications with taking these vaccines include any person who is hypersensitive or known to be allergic to any components of the vaccine, any person with prior severe allergic reactions after a previous dose of any ingredient in the vaccine, any person who developed an allergy 72 hours after a previous dose, any person with a severe neurological condition such as transverse myelitis, Guillain-Barré syndrome, and demyelinating disease, and any person with an uncontrolled severe chronic disease. Please do note that pregnant and lactating women can take all of the above vaccines except for the CanSino Bio vaccine. There are side effects that could occur once you take the vaccine, and these include pain, redness, and swelling on the arm. You may also experience tiredness, headaches, muscle pain, chills, fever, and nausea. There are many methods you can use to alleviate any discomfort you face, and this includes using a hot compress over your arm and using your arm gently. To reduce fever and pain, you can drink plenty of fluids, wear loose-fitting clothes, and take paracetamol for any pain. Talk to your doctor about taking over-the-counter medications such as ibuprofen, acetaminophen, aspirin, or antihistamines. You can take these medications to relieve post-vaccination side effects if you have no other medical reasons that prevent you from taking it normally. However, it's not recommended you take these medications before vaccination to try and prevent the side effects. Evidence is emerging that people get better protection by being fully vaccinated compared with having had COVID-19. One study done in Kentucky from May to June 2021 showed that unvaccinated people who already had COVID are more than 2 times as likely as fully vaccinated people to get COVID again. Furthermore, a French study published on 11th October 2021 was done on individuals over the age of 50, showing that because of all the reasons above, it is highly encouraged for you to take the vaccine if you can. It will not only benefit you, but also your community. It is the best defense we have against the virus, so please play your part and take the vaccine.